Can you give us an update on the cases in our community and what's going on?
Yep, so as of December 1st, 2020, in KFL&A, we've had a little more geographic spread of individuals getting COVID-19. So for example, at a workplace, we had 2 individuals test positive, no risk to the public, and there was a clear risk of travel in those individuals. We had 4 individuals test positive in Sharbot Lake, who, again, there was a link to travel amongst them, and then the rapid transmission of the virus. No risk to the public in that workplace. And in Kingston, we've had a workplace outbreak associated with a healthcare setting, as well as a gym that also, sadly, 2 individuals at the hospital, so workers at a hospital also tested positive, but we haven't been able to see any transmission within the healthcare setting. So as you see, there's a theme: travel, travel, travel as the risk, because the risk of infection is 10 to 20 times higher as soon as you leave KFL&A. The safest thing to do is to stay within our region, stay within your household, and your risk will be diminished significantly. We have noticed when we've investigated activity amongst healthcare workers, we would really want all healthcare workers to review their infection prevention and control, review how to put on a mask, take off a mask, good hand hygiene, because despite these processes in place, we've had a couple of healthcare workers test positive. So that really reminds us that we want our healthcare workforce protected. The other piece that's coming to mind now is when we look at a graph of the total number of cases or individuals with COVID-19 over time. Remember when we first had this outbreak, we had a peak that we were able to get under control, then another peak in June, another peak when students returned. But the time between these peaks is shortening. And hence our ability to respond quickly is getting a little more difficult as we're getting wave after wave after wave. But have to thank the lab and our assessment centers, our primary care partners, for providing us with the data that enables us to respond. Big question is what's going to happen in December and January, and our fate is in our hands. Wash them and stay within your family unit. We'll be putting in place some risk communication strategies for the holidays, but everyone's going to have to review their plans, because if we have significant activity in January, that is when we have a risk of going from yellow to orange or orange to red in terms of the Ontario framework, and an impact on the healthcare system. So you've done really well so far. Let's stay to the best practices, stay within our household, wear our masks, wash our hands, screen and risk every time you leave your household, and I think that'll put us in very good position.